Hi, my name is Dr. Rappe. I'm a certified functional medicine practitioner and the co-founder of Thrive Functional Wellness Center. If you're new to functional medicine and are wondering what it is, well, it's really pretty simple. Functional medicine, we identify what is the underlying cause of your symptoms and then work to resolve the underlying causes using all natural methods. We don't prescribe drugs or medications that are only going to mask or minimize your symptoms, and then you take those for the rest of your life. Functional medicine is all about that underlying cause and working to eliminate the underlying cause using all natural methods, literally healing the body from the inside out. I'm really excited to share this webinar with you today, and I hope that you find it educational, enlightening, but most importantly inspiring. I hope it inspires you to take action, to take that very first step to regaining your health naturally. You know, I say this a lot, and it's true. If you want a different outcome, you've got to do something different. It's that simple. And that's what we've done here at Thrive Functional Wellness Center. For 30 years, we've changed lives through our holistic approach, and we look forward to helping you change yours too.
Gut, Stress, and Inflammation, presented by Dr. Gray Rappe, a certified functional medicine practitioner, board eligible in functional nutrition, and completed a board certification course in neuropathy. So what we say here at Thrive Functional Wellness Center is pretty simple. If you want a different outcome, you've got to do something different. We all know what Albert Einstein said many years ago. Doing the same thing over and over and over again, expecting a different outcome, is the true definition of insanity. In my opinion, America's healthcare crisis starts with the big pharmaceutical lie. We all know what it is. We see it on TV all the time. If you watch their commercials, they show happy people, smiling people, dancing people. They even show a guy who's singing and dancing and mowing the lawn. Well, I mowed lots of lawns when I was a little boy trying to make money to go to the movies. And guess what? I never sang and I never danced. Believe me. So the big pharmaceutical lie is huge, and it's all based on money. They're associated with insurance and the misleading information that's out there. People come to me all the time and say, well, I have a health insurance card. And I say, well, that won't make you healthy. You still have to make good choices. So the pharmaceutical companies and insurance have one thing in mind, and that's really all about the money. The bottom line for them is money. They want to make money for their shareholders. They're in business to do so, and that's really what it comes down to. If we look at Blue Cross Blue Shield, which is a really good insurance, their PPO pays for everything, right? Wrong. It doesn't pay to educate people on how to eat properly. They don't have the kind of classes that what we teach. Our goal is to teach, teach, and teach. They don't do that, number one. Number two, they definitely don't give refunds and rebates for people who go to the gym and get into a really good shape. I'm in as good a shape today at 60 years old as I was when I was 30. So I should be getting some kind of rebate. And lastly, when it comes to organics, let me talk just a little bit about organics. Many people think, oh my goodness, organics are too expensive. Years ago, when there were very few players in the organic arena, guess what? They were expensive, but today they're not. For a few cents more, you can feel comfortable that when you're eating a piece of fruit, as in this picture would show, if you ate a piece of fruit from there and it was from Europe, it might have 2 different pesticides on it. In the United States of America, if it's not organic, it could have as many as 200 pesticides on it. So believe me, it's well worth the few pennies for you to eat organic foods, because the inorganics with the pesticides are going to affect your body's physiology, your body's chemistry, and how your body works metabolically. Lastly, insurance pays for 3 main things, and that's it. They pay for doctor visits, they pay for drugs, and they pay for surgery. They don't pay for the kind of wellness things that you need to be doing to be as healthy as possible so you can live life to its fullest. 75% of the $2.7 trillion we spend on healthcare is spent on treating diseases that are largely preventable. Preventable means something that we can keep from happening. I've never met a baby that had heart disease, and so they develop it over time. So that's a really important fact there. $2.7 trillion, 75% of that is spent on diseases that are largely preventable. For those of you who are Medicare recipients, this is really important. This comes directly out of the Medicare guidelines. I just referred to what does insurance pay for. Doctor visits, drugs, and surgery. So Medicare guidelines sections 2251.3 read the following, quote, a treatment plan that seeks to prevent disease, promote health and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is not deemed medically necessary. That's right. Totally backwards. So they don't pay for the things that we can do for you to help you be as healthy as possible and maintain your health so you can enjoy life to its fullest. They don't pay for that. They pay for drugs, doctor visits, and surgeries. We spend $425 billion a year on pharmaceutical drugs in the United States alone. $425 billion represents 75% of all the drugs manufactured on the planet year after year after year, and they're consumed here in the United States. Why is that important? Well, it's important because the United States only makes up 5% of the world population. I'd say we're being over-medicated. Harvard Medical School says chronic inflammation plays a central role in some of the most challenging diseases of our time. The Journal of Clinical and Cellular Immunology says chronic diseases are caused by chronic inflammation. Chronic inflammation sets off a cascade of disease-causing effects that has been linked to Alzheimer's disease, cancer, heart disease, diabetes, just to name a few. People with chronic inflammation have a much greater risk of developing chronic disease. Heart disease in the United States runs rampant. 610,000 people die every single year in the United States from heart disease. That's 1 in every 4 deaths. Heart disease is also the leading cause of deaths for both men and women. Research has shown approximately 80% of all cardiovascular disease can be prevented by reducing inflammation, controlling high blood pressure, diabetes, and high cholesterol, along with adopting healthy lifestyle behaviors. Some of the diabetic facts that most people don't know about: more than 100 million Americans have diabetes or prediabetes. Diabetes drives a systemic inflammation. Diabetes is the number one cause of blindness and kidney failure. People with diabetes are 4 times more likely to have a heart attack and a stroke because of the inflammation. And diabetes has tripled since the 1980s, and it'll triple again between now and 2030. Are the drugs helping? I'd say they're not. The true underlying cause of diabetes, or type 2 diabetes, insulin resistance. What that means is I eat a meal, and that meal converts into glucose in my blood. My insulin is produced by my pancreas, so my pancreas dumps insulin into the bloodstream, and insulin's job is to take the glucose to the cell for energy. That's normal physiology. However, due to the great American lifestyle, the high stress, poor eating habits, lack of exercise, lack of rest, all the things that we experience on a daily basis, we build what's called insulin resistance at the cellular membrane. So when insulin is trying to deliver its package, it gets blocked by this resistance, and my blood sugar goes up. What does your doctor do? You need metformin. The number one prescribed drug for type 2 diabetes is metformin. Not only is it horrible for you, it's really hard on your kidneys, but it doesn't really work. It'll lower your blood sugar temporarily, but your blood sugar will climb up, and your doctor will just continue to increase the dose until you've maxed out the dose for metformin. What's next? Another drug stacked on top of it. It's the classic medical model. Keep stacking up drugs. Eventually, it'll work. This individual came to us, and he was a full-blown type 2 diabetic. He'd been working with the same doctor for 20 years, and he had done just that. His doctor had kept stacking up drug on top of drug on top of drug, and 20 years later, he shows up in my office, and he basically says, I just want to die. His wife is crying, and I said, no, we're going to help you, and this is how we're going to do it. We walked him through our program. 3 months later, you can see his A1C. He started out at 9.4. At 9.4, he was on 3 oral medications, 2 different insulin injections twice a day. So his doctor had stacked him up and made him worse. Now, 3 months later into our program, his A1C number was 5.4, which is normal. He wasn't taking any more drugs. He was completely off his drugs, lost 65 pounds. He went back to his doctor, and his doctor looked at his labs, looked at him, and got up and walked out of the room. Why? Because he literally failed this patient for 20 years, and we worked with him for 3 months and turned his diabetes around. Thyroid Facts. 30 million people in the United States of America have a thyroid disorder. Half of those are undiagnosed. Females are 5 times more likely than males, and 20% of diabetics will have a thyroid issue. The thyroid is a really important gland, and it supports the following areas: bone metabolism, immune system, brain and nervous system, gastrointestinal function, liver and gallbladder, growth, sex hormones, estrogen, fat burning, including belly fat, insulin and glucose metabolism, healthy cholesterol levels, and proper stomach acid. So for those of you who weren't aware, the thyroid is really, really important gland.
We have a very different way of thinking in functional medicine, which is actually looking at how the body affects the brain. We're now learning that your microbiome, this ecosystem of bugs in your gut, has been linked to depression, to ADD, to autism, even to Alzheimer's. So we always thought the gut and the brain were sort of disconnected. Maybe if you're stressed, you'll get diarrhea, but the fact that your whole gut environment is driving changes in your brain is a very new discovery.
So there's 3 types of negative stress that we all experience. The first is physical stress. It can be different for all of us. Basically, it's overdoing it, over-exercising, overworking. Maybe you're out in your yard working too hard. It's hot. You're not getting enough water. But physical stress, again, can change our body's physiology, our chemical makeups, as well as our underlying metabolic processes. Chemical stress, everyone is exposed to chemicals on a regular basis. I showered this morning, I used soap, I used shampoo, I had a body wash, I put on deodorant and cologne, my clothes were all washed in some kind of chemical to clean my clothes. So chemicals are everywhere. People that drink out of plastic bottles, it's just in the air. When the wind blows, it gets up into the air. So we're exposed to chemicals on a regular basis, and they affect our body's chemistry. They affect all of our metabolic processes and productions, as well as our ability to function normally. Emotional stress is one that's different for most people. You may have a boss that's a little overly aggressive. Maybe you have a job where you're doing 2 or 3 people's job and being paid for one. I'm not sure what it is. Maybe you have grandchildren who aren't doing well in school or getting in trouble with the law. Maybe you have children who have children, and your particular kids are struggling with their business, or maybe they've lost their jobs. Something has happened and it's causing you emotional distress. In my particular case, I've had a couple of family pets pass away in the last year, and that's incredibly emotional. It's very, very difficult and challenging, and it takes a long time to process through. It's a very long mourning process. That changes you. It changes your physiology, it changes your chemistry, it changes your metabolic processes, and it just has a dramatic downward spiraling effect on your body as a whole. Up to 90% of human diseases are related to the activation of stress system. Chronic inflammation is the essential component for chronic disease. The father of medicine, Hippocrates, said 2,500 years ago, all diseases begin in the gut. The guy was so far ahead of the game, it's unbelievable. We're just starting to get back to the belief system that all disease begins in the gut.
The reality is, we did not evolve as human beings to have a high simple carbohydrate diet, but we are awash in simple carbohydrates now. So there may be a number of links between leaky gut and Alzheimer's, but an obvious one is that with leaky gut, you produce a state of chronic inflammation. And inflammation unquestionably is pro-Alzheimer's. For example, just the activation of NF-kappa B, one of the inflammatory mediators. Some of the genes that this affects turn out to be the very ones that cleave the amyloid precursor protein to produce the amyloid. So you are putting yourself in a pro-Alzheimer's state if you have chronic inflammation. And leaky gut is a great way to produce chronic inflammation. In addition, of course, you end up with fragments of bacteria that actually end up in the brain. You can see them sticking literally at the site of the amyloid plaques.
So 9 signs that you may have leaky gut. You don't have to have all of these, and you don't have to have even one of these, but these are classics that we see. Digestive issues, gas, bloating, and diarrhea, food allergies, brain fog, mood imbalances, skin issues, seasonal allergies, hormonal imbalances, autoimmune disease such as rheumatoid arthritis, Hashimoto's, psoriasis, and celiac, just to name a few, as well as a diagnosis of chronic fatigue or fibromyalgia. What is leaky gut? Well, 8 out of 10 people have leaky gut syndrome. Most of them don't know it. But if you look at this picture, over here, this is normal physiology. These cells, the lining of the intestines, are held tightly together by a protein called zonulin. It creates what's called a tight junction. So when I break down foods normally in my gut, the smallest micronutrients can slip through here into the bloodstream. That's normal physiology. But as I develop inflammation due to stress, due to overwork, due to inappropriate eating, alcohol consumption, drugs, whatever it happens to be, I develop inflammation along the spine, and you can see these tight junctions now start to open up. When they open up, that's when we've developed what's called leaky gut. And you can see all of the bad things that should not get into our bloodstream now can leak through here and into my bloodstream, and they can really trigger some horrific events. Including in those things would be undigested food particles or large protein chains or sequences of protein chains that may also trigger an autoimmune response. So you can see as I develop leaky gut, it's an inflammatory process that not only affects my gut, but it will affect my brain as well. We see nutrient malabsorption, autoimmunity, food intolerances, brain barrier breach, as well as systemic inflammation due to leaky gut.
And we have gut dysfunction. Gut dysfunction is probably the other major driver of inflammation, because when your gut's inflamed, like most of our guts are, it creates inflammation not just in your gut, but throughout your body and in your brain.
Stress, anxiety, depression. The World Health Organization says by 2020, that's next year, stress and depression will be the second most prevalent disease worldwide. 95% of illnesses are worsened by stress. 21% of girls are depressed. Females are 2 times more likely than males to experience depression. Depression can cause stress, hormone imbalances, nutritional deficiencies, and toxicities, as well as have a negative impact on school performance and test scores and personal relationships with young people. This is one of our clients, Real People, Real Solutions. I was having some emotional problems and conventional doctors couldn't do anything but give me drugs. I didn't want to take drugs. I had depression, anxiety, and anger issues. After visiting Thrive Functional Wellness Center, it turns out that I had gut issues and food allergies. After working with Dr. Rappe, I no longer have depression, anxiety, or anger issues, and I'm happier than I've ever been. Thank you, Dr. Rappe, for giving me my life back. Trudy. As you can see here, Trudy on the right, Trudy over here on the right, when she first came in, not in a good place, 65 pounds. She lost 65 pounds doing our program. We got her body chemistry back in range. We got her brain chemistry working properly. She got off all of her depressive medications and her anxiety medications. She's living large and happy in life again today. What's your medical doctor's solution for all of this? Well, your medical doctor's solution for gut issues, stress, and inflammation is pretty much drugs, drugs, and more drugs. We know that drugs are only going to minimize your symptoms. They don't correct the underlying cause. In the last slide of Trudy, we had to identify what was the underlying cause, and then we went after that underlying cause using all natural methods. We cleaned up her gut, we cleansed her gut, we repaired her gut, we got her hormones back in line, we were able to get her manufacturing serotonin again, took her out of depression, all using natural methods. Again, your doctor's solution is drugs. Freedom to choose. The freedom to choose is pretty straightforward. The choices that you've made prior to listening to this video, that's what really established your health status as you watch this right now. However, your choices are the foundation to your health. So moving forward, you can choose to remain sick, or you can make different choices and become healthy again. The past, the present, and the future. Freedom to choose. Your choices are the foundation for your health in the past, the present, and the future. What this means is every choice that you made prior to watching this video is what established your health status as you sit here right now. The choices you make in the future will determine whether you remain sick or whether you become healthy again. Failure to take action and do something different leads to the same outcome. The 3 R's of Thrive Functional Wellness program. The 3 R's are pretty straightforward. We want to remove toxicities, reverse the underlying causes, and we want to rebuild your health from the gut out using all natural methods. What is our program and what it's not? It's not a 5 to 7 minute chat with your doctor who's going to just prescribe you more medications. What our program is, it's a consultation with a certified functional medicine specialist, a comprehensive history metabolic assessment of all organ systems, and then I'm going to review your previous labs so that I can point out to you some of the areas that either your doctor didn't talk about or the classic, oh, your labs are fine. We want to review them and point out things that aren't fine and how they correlate to your present symptoms. Once we've done that, if it looks like you and I are going to work together, I'll present you with a plan of action and what it looks like moving forward. If you're accepted into our program, we're going to run all the correct tests necessary to really identify what's the true underlying cause. We want to determine the true underlying cause and focus on the cause, not the symptoms. We want to address the body as a whole. We want to use a systematic approach. It's easy to follow and it's step by step. What does that mean? A systematic approach means that over the last 30 years, we've been able to put together a program that works. It's a custom program for you as an individual. I customize it myself, but it's based on knowledge. You see, knowledge is only powerful if you apply it. So we provide you the knowledge in a very step-by-step, easy-to-apply knowledge, and then we teach you through mentoring and coaching how to apply that knowledge on a daily basis. So again, we use professional, certified mentoring and coaching to help you on a daily basis apply the knowledge so that you'll be successful like all of our other clients. The 5 pillars of health are really straightforward. We treat the whole person. We start out with detox, clean, cleanse, and repair. We've got to get all of those toxins out of your body and get your body functioning normally again. Get all of your organ systems working together in unison like they're supposed to, because you're a whole body, not just a single organ. Then we've got to teach nutrition. We teach scientifically based nutrition. It's really important to eat the foods that are going to help you and make you healthy and keep you from eating the foods that have made you sick, like the foods you've been eating thus far. Nutrition is incredibly important. Fitness. Everybody has to exercise. We have to exercise, but the key is this. We don't all have a lot of time. I don't expect any of our clients to spend hours and hours in the gym. I don't have time to do that. So we teach a very specific type of fitness. It's more methodology than anything. It helps to elevate all of your hormones, and it'll also stimulate the frontal cortex of your brain, increasing its size and its strength to stave off any possible fitness. We've got to do fitness. Fitness is really important for a number of reasons, but we don't have a lot of time. I don't have a lot of time, and you might not either. So we don't expect our clients to spend hours and hours in the gym. What we do expect for you to do is 30 minutes 3 times a week, a very specific type of exercises that are going to stimulate hormone production to help get you into hormone balance, as well as strengthen and increase the size of your frontal cortex to help stave off any cognitive degenerative issues that may be in the foreseeable future. When it comes to hormones, we test everybody's hormones. We're looking to see highs and lows, and we're going to use our supplement protocols to get you back into balance. And the last is coaching and mentoring. Coaching and mentoring is a huge part of our program. I just mentioned that. Why is it important? Because everybody needs a coach and everybody needs a mentor. I was in the 1984 Olympic trials as a pole vaulter. I didn't get to that level of athletics by myself. I had mentors. I had coaches. I had people working with me as a team to help me get to that level. And we use professional, certified coaching and mentoring in our office with all of our clients. We're going to literally take you by the hand and walk you through your very own customized step-by-step program to achieve optimum health. We know that 94% of failure is due to not having a system, and therefore we've developed a system that makes it easy for you to succeed. I am a certified functional medicine practitioner. I didn't talk about that much at the beginning, so let me go back and clarify that. What does that mean? Well, I practice functional medicine in my office. What functional medicine is really identifying what is the underlying cause of your symptoms and then resolving that cause using all natural methods. I call it the what medicine. What is the underlying cause of your symptoms and resolving it using all natural methods. As opposed to my colleagues who work in the medical model, they were trained in school to identify your symptoms and what drug to give you to minimize your symptoms, and then you would take those drugs for the rest of your life. So the difference is simple. They give you drugs to minimize your symptoms. You stay on the drugs for the rest of your life. And what we do is we identify the true underlying cause of your symptoms, and resolve those symptoms using all natural methods. Functional medicine.
My name is Jeff, and I'm here to talk about the Thrive Wellness Program. I signed up with it a little over a year ago, and before I signed up, I was diabetic. I weighed 290 pounds. I had high blood pressure, no energy. I was up 3-4 times a night. If I was lucky, I was sleeping 3 hours a night. So I was tired all day. I had brain fog bad. My son keeps telling me, like, you're repeating yourself, you're repeating yourself. I would tell him 4 or 5 times the same things. I would go to a job and not realize how I drove there sometimes. And I just noticed every day it was getting progressively worse and worse. And even some of my activities, I like the outdoors, I like to fish and hunt. And just going, I couldn't climb hills, I couldn't walk half the time. I was just no energy at all. And I had come into the Dr. Rappe for chiropractic and was visiting him for a few weeks. And I ended up, Julie here, sweetheart, she signed me up, told me to come to this seminar and try it. And it was the best thing I've ever done. I mean, listening to Lori and Dr. Rappe speak was genuine from the heart, and you knew they were here for you. So I signed up on September 1st. And 2 months into the program, I really started to notice a difference. I had a little bit more energy, and I was losing a little bit of weight, but I just was noticing differences. And the best part about this program, I always have people ask me, like, well, what are you doing? What is it? Well, it's more than what I'm doing. It's the program. It's the testing. It's seeing what's wrong with you, analyzing you, giving you the proper supplements. And not only that, but the moral support. I mean, any questions, you can email them. They respond. They answer your questions, and it's been great. And 5 months after my 5-month program was over, I went to my doctor. And my doctor basically took me off all my meds. She was astonished. No more diabetic, no more high blood pressure, no more cholesterol. Everything cleared up. I also had fatty liver disease, and that was like 3/4 gone, which when I went back in May, it's now my liver's normal. It's been such a phenomenal difference. I feel like I'm in my 20s. And I'm just speechless at how wonderful this program works and how I feel. It's been great. And the best part too is sure, I've lost all the weight, but it's the energy, it's everything else I've gained with it. And the main knowledge that I've gained is how to look at my body, and I know what I can eat, I know what I can do, and not ignore the little symptoms, whether it's, inflammation or allergic reactions, and reacting to it. And this course taught me all that. And I highly recommend it to anyone that wants to change their life, whether it's weight loss, whether it's just getting off their meds or anything. It's just been just about a year. I've lost 104 pounds. No more diabetic, no more anything. Like I said, my energy level is through the roof. I had to go down and get a new driver's license because no one believes it's me and my driver's license. So it's been a total 180 degrees. I weighed what I weighed in middle school, which is incredible because I've been heavy my whole life. But I highly recommend it to anyone if you want to change your life.
What an incredible story. What an incredible story. What happened is simple. He took us on as his coaches and his mentors. We taught him through a curriculum-based program, and then we taught him how to apply it every single day. And he took everything that we gave him and he applied it just like we told him, and he got amazing results. Families are priceless. This is my family here. My daughter on the left. She graduated from Cal State Fullerton. My son on the right. He was a scratch golfer in high school. Just an incredible family. I'm so lucky to have them. A story about myself I didn't tell early on is that when I was a little boy growing up in Minnesota, my mom died of cancer when I was 6 years old. And that loss was so horrible and so horrific. I truly believe that it really guided me down this path to become the health and wellness expert that I am today. And I remember prior to getting married, my wife and I sat down and I said, listen, honey, this is, you know the story about my mom dying of cancer. I said, I want to tell you something. I will do anything and everything, regardless of cost, to make sure that that doesn't happen to our kids. So families are priceless.
Yeah, my name is Harold Adams. I'm originally from Santa Barbara. My wife and I moved here in 1999, and we live in La Quinta right now. I've been sick with an illness for 40 years. I have been to, I can't even imagine how many doctors, probably 25. I have gone to the best doctors in Santa Barbara. I've gone to several doctors in Los Angeles. I went to UCSD to a professor, and all of these doctors and visits proved nothing. Everything was done looking at my blood. Everybody said I was okay, but I had an ongoing illness of feeling dizzy and sick. Most of the time, I would break out soreness in my head, up in my temples, up in my scalp. With all these visits, I even flew to Texas once to another doctor. All these visits, I probably spent at least $100,000 of my own money and coming up with nothing. I came here to Dr. Rappe, and I have never had relief before. According to this plan, I finally got relief. I highly recommend anybody with any kind of a condition to come here and see what they can come up with.
Thrive Functional Wellness Center. So what do we offer? We offer a consultation with a certified functional medicine specialist. We offer a comprehensive history and metabolic assessment. We're going to review all previous labs so we have an idea of baseline, what's going on with you. And many times I'll find things on your labs that your doctor just isn't talking about. The classic I hear patients say to me when they come in, they say, my doctor said my labs are fine. And then I go through that, the set of labs, and I find numerous things that are not being told to them. After we've done all that, if it sounds like that this could work out for us and we might work together and I choose to take you as a client, I'll provide you with a plan of action. All of that will happen in about an hour of time. My normal hour of time is 287. However, I have a gift for you today. You spent the time to listen to this. This tells me that you're looking for something different. I believe you're on the edge of making the kind of decision that could change your life forever. Remember what I said at the beginning. If you want a different outcome, you've got to do something different. I've been in private practice in the Coachella Valley for 30 years, and I don't want there to be any obstacles whatsoever for anybody to come in and see if this program will work for them or to contact us over the internet through emails, and whatnot, so that we can work with you at a distance. But I want to take that and I'm going to reduce that today. That's my gift. I'm going to reduce that today to a simple 87. So again, if you're interested in a consultation with me, contact my office. It's very straightforward. Here we go. Anybody know who this is? Yeah, this is Steve Jobs. Well, you know what? Steve Jobs had $10.5 billion in the bank at his time of death. And what I say to Steve Jobs is, if not now, then when, Steve? Steve Jobs did what a lot of us have done. Not myself, but others. They take their health and they put it on the back burner. Everything else has a greater priority than their health. The watch on their wrist, the purse on their arm, the shoes on their feet, the car they drive, until one day when something really bad happens and they wonder, oh my goodness, did I just make the biggest mistake of my life? So I'm saying to you, don't make that same mistake. If you want a different outcome, you've got to do something different. If today's talk was inspiring to you and you're ready to do the right thing and take the right steps moving forward, please contact our office at 760-777-4177 or contact us at any of the contacts below. Our website, thrivefunctionalwellnesscenter.com, Facebook, Thrive Functional Wellness Center, or Instagram, Thrive Functional Wellness Center. I've helped many, many, many people over 30 years, worked with tens of thousands of people successfully during that time, and I'd love to help you achieve optimum health again. Remember, your health is your true wealth. Thank you very much for listening, and have a nice day.
If you have any questions about our program, please contact us using the numbers and emails on the screen. We look forward to helping you regain your health and thrive again. Because believe it or not, your health is your true wealth.